If you're over 60 and that sharp, burning pain shoots from your lower back down your leg, listen closely, because what I'm about to share may change how you deal with sciatica, starting today. You're not weak, you're not broken, and you're definitely not too old to feel better. Many adults over 60 wake up every morning already bracing for pain. Pain when they stand. Pain when they walk. Pain when they try to sit comfortably in a chair they've used for years. Sciatica doesn't just hurt your back. It steals your confidence. It makes simple things, like getting out of bed or going for a short walk, feel risky. And the most frustrating part? You may have tried pills. You may have tried rest. You may have even been told, "This is just part of aging." But deep down, you know that answer doesn't feel right. Here's the truth: most seniors are never told clearly. Sciatic pain is often less about damage and more about pressure, stiffness, and nerve irritation that builds up slowly over time. As we age, we naturally sit more. We move less. Our hips tighten. Our posture changes. All of this can quietly squeeze the sciatic nerve, day after day, until one morning, the pain feels sudden and overwhelming. That's when fear sets in. You start wondering, will this ever go away? Will I be able to walk normally again? Is this the beginning of something permanent? These are very real concerns, and you're not alone in feeling them. But here's the hopeful part. Many seniors are finding relief. Not through stronger pills, not through risky procedures, but through one simple, gentle movement that helps take pressure off the sciatic nerve naturally. No floor exercises, no extreme stretching, no twisting that feels unsafe. Just a controlled, senior-safe movement that works with your body instead of against it. And when done correctly, this movement can help calm the nerve, relax tight muscles, and restore a sense of control over your body again. Not overnight miracles, not medical promises, just steady, noticeable relief that starts with understanding what your body actually needs at this stage of life. In the next part, I'll explain, clearly and simply, what sciatica really is, why it becomes more common after 60, and the everyday mistakes many well-meaning seniors make that unknowingly keep the pain going. Because once you see what's really happening inside your body, the solution begins to make sense. And that's when everything starts to change. Let's slow things down and talk plainly about what's really going on. Sciatica is not a disease. It's not a diagnosis. It's a description of pain that follows a nerve. That nerve, the sciatic nerve, is the longest nerve in your body. It starts in your lower back. It travels through your hips and buttocks, and it runs all the way down each leg. When this nerve becomes irritated or pressured, you feel it. Not just in your back, but deep in your hip, down the back of your thigh, sometimes even into your calf or foot. That's why sciatica feels different from ordinary back pain. It can burn. It can tingle. It can feel sharp, electric, or achy. Now here's what matters most for adults over 60. In many cases, the sciatic nerve isn't injured, it's crowded. Over time, normal aging changes how we move. Muscles that once stayed flexible become stiff. Joints lose some natural range, and posture slowly shifts forward. The hips are especially important here. When hip muscles tighten, and they often do with sitting, the space around the sciatic nerve gets smaller. Less space means more pressure. More pressure means more irritation. This is why pain often feels worse after sitting, or when standing up from a chair, or first thing in the morning. And this brings us to the first common mistake. Mistake number 1, too much rest. When pain shows up, resting feels logical. And short-term rest can help. But long-term stillness often makes sciatica worse. Muscles tighten even more. Joints stiffen further. The nerve has even less room. The body doesn't heal well in total inactivity. Mistake number 2. Aggressive stretching. Many seniors are told to stretch it out, so they bend forward hard. They pull on the leg. They force movements that feel uncomfortable or painful. This can irritate the nerve further. The sciatic nerve does not like sudden tension. It responds better to gentle positioning and controlled movement. If a stretch causes sharp pain, burning, or numbness, that's your body asking you to stop. Mistake number 3. Ignoring posture. Posture isn't about standing straight like a soldier. It's about balance. As we age, we often lean slightly forward without realizing it. The head drifts ahead of the shoulders. The lower back flattens. The hips stay bent for long periods. This position quietly compresses the lower spine and hips. Even if you exercise, poor posture throughout the day can undo the benefits. Mistake number 4. Chasing quick fixes. Pain pills may dull discomfort, but they don't change pressure on a nerve. Relying only on pills can delay learning what your body truly needs: movement that creates space, not strain. Now here's the encouraging part. The body is adaptable at any age. Nerves calm down when pressure is reduced. Muscles relax when they feel safe. And joints move better when motion is gentle and consistent. This is why one specific, carefully chosen exercise can be more helpful than many random movements. Not an intense workout, not something exhausting, but a movement that does 3 key things. First, it opens space around the sciatic nerve. Second, it relaxes tight hip and lower back muscles. Third, it sends a signal of safety to the nervous system. When those 3 things happen together, pain often eases, slowly, naturally, without forcing anything. In the next part, I'll walk you through simple, senior-safe daily habits, including 1 key exercise that many older adults use to calm sciatic pain and move with more confidence again. Each step will be clear, each movement will be realistic, and everything will respect the body you have today. Now, let's talk about what you can do. Not extreme workouts, not complicated routines, just calm, realistic habits that fit an over 60 body. These are movements many seniors use daily to reduce pressure on the sciatic nerve and feel more in control again. Always move slowly. Never push into sharp pain. Comfort comes first. Habit 1. The seated sciatic relief exercise. The 1 exercise. This is the single movement many seniors find most helpful. You can do it in a sturdy chair. No floor, no special equipment. Here's how. Sit near the edge of the chair. Feet flat on the floor. Sit tall but relaxed. Now gently extend one leg forward. Keep the heel on the floor. Toes pointing slightly up. You should feel a light stretch behind the thigh. Not pain, just gentle tension. Next, slowly lift your chest. Imagine a string gently lifting the top of your head. Hold this position for 10 to 15 seconds. Breathe slowly. Then relax the leg back down. Repeat on the other side. Do this 3 to 5 times per side. Why this helps? This position gently reduces pressure around the sciatic nerve without pulling on it aggressively. It creates space. It sends a calming signal to the nervous system. Many seniors feel relief immediately or within a few minutes. Habit 2. Gentle hip opening. While standing, tight hips are one of the biggest contributors to sciatic irritation. This movement helps without forcing flexibility. Stand behind a chair. Hold the back for support. Slowly move one leg back. Keep the toes pointing forward. Knee stays soft. You're not kicking, just gliding the leg back slightly. Hold for 5 seconds. Then return to center. Repeat 5 times. Switch sides. This encourages hip movement and reduces stiffness from sitting. Habit 3. Walking in short, relaxed intervals. Long walks can be painful with sciatica, but short walks are often helpful. Think in minutes, not miles. Start with 3 to 5 minutes. Walk at a comfortable pace. Arms relaxed. Stop before pain increases. Rest. Then walk again later in the day. Movement pumps blood to nerves and muscles. This helps reduce irritation naturally. Habit 4. Sitting breaks. Every 30 minutes, sitting too long increases nerve pressure. Set a gentle reminder. Every 30 minutes, stand up, stretch lightly. Take 10 to 20 steps. Even 1 minute makes a difference. This prevents pressure from building up again. Habit 5. Calm breathing to relax. The nerve pain tightens the body. Tightness increases pain. This breathing helps break that cycle. Sit comfortably. Place one hand on your chest, one on your belly. Breathe in slowly through your nose for 4 seconds. Feel the belly rise. Exhale slowly through your mouth for 6 seconds. Repeat for 2 minutes. This calms the nervous system. A calmer nerve feels less pain. These habits work together. They don't force the body. They don't exhaust you. They gently remind your body how to move safely again. Consistency matters more than intensity. In the final part, I'll share encouragement many seniors need to hear, especially if pain has been present for months or years, and how to stay hopeful and confident moving forward. If you've made it this far, there's something important I want you to hear clearly. It is not too late. Not too late to move with more ease. Not too late to feel more confident in your body. Not too late to reduce pain and fear around movement. Many adults over 60 quietly believe that pain is a life sentence, that once it arrives, it only gets worse. But the body doesn't work that way. The body listens. It adapts. It responds to how you treat it at any age. When you move gently and consistently, muscles soften. When pressure is reduced, nerves calm down. When fear decreases, the body relaxes even more. This is a powerful cycle, and you can start it today. You don't need perfection. You don't need to do everything at once. Even one gentle exercise, even one short walk, even one posture break. These small actions add up. Some days will feel better than others. That's normal. Progress is not a straight line, especially after 60. But steady effort creates real change over time. Be patient with yourself. Your body has carried you through decades of life. It deserves care, not punishment. If pain has made you afraid to move, that fear is understandable. But gentle, safe movement is often the path forward, not something to avoid. Think of movement as medicine. Slow, consistent, kind. And remember, relief doesn't always mean pain disappears completely. Often, it means you feel more control, more confidence, more freedom to live your day. That alone can change everything. If this message helped you, take it as a sign to keep learning how to support your body naturally. Pay attention to what feels safe, what feels calming, what helps you stand a little taller and move a little easier. Your future comfort is built from today's small choices, and no matter your age, your body is still capable of positive change. Thank you for spending this time with me. Take care of yourself, move gently, and keep hope close. If you found this helpful, consider supporting content that focuses on senior health, movement, and confidence, so more people can learn that aging does not mean giving up. You deserve comfort, you deserve dignity, and you deserve to feel good in your body again.